DC. Alongside the design studio there, and he contributes lectures at Cork Centre for Architectural Education. And he's lots of interests, including healthy and platform urbanism, which you'll have to explain to us, Jack, and holistic systems approaches to built and digital environments, community engaged change and policy reform. Okay, so Jack, so over to you. So we'll have about 25 minutes maybe for you, and then we'll have a question and answer session after. So thanks, Jack.
Excellent. So again, thank you very much for having me here today. As mentioned, I'm responsible for coordinating and overseeing the successful delivery of the SmartTA program. And what I'd like to do today is essentially give you a cross-section of where we've come from, where we're at, and where we're going. So for those of you who aren't immediately familiar with what SmartTA is, SmartTA is an innovation district and urban demonstrator focused on solutions to global challenges in population health and well-being. And specifically, we work across sectors by working with citizens and service providers to then scale innovations locally, nationally, and internationally. And our SmartTA initiative is very young, but I like to think that we've done a lot so far, but we have more to go. We're in our 3rd year of operation and situated right here in the heart of Dublin. As we're all mindful of in the room today, healthcare faces a multitude of challenges with limited resources. And, you know, this provision is very much related or entangled with how we organize our society before we ever step foot inside a doctor's office or a hospital. Where there can also be many structural barriers or inequities that affect access to population health or opportunities to improve it at scale. So when it comes to factors that obviously cause us to be healthy, there are emerging global trends such as aging population, more people now dying of chronic disease like heart disease and cancer than infectious diseases, when it used to be the other way around. Novel or new infectious diseases such as COVID, globalization of unhealthy behaviors, like not getting enough exercise and poor diet have coincided with trends towards urbanization. And as people live longer with chronic disease, that is costly to treat over many years. And then, of course, by extension, it means healthcare costs are going up. And finally, there's huge disparities in health within and across countries, regions, and districts. So there are other societal challenges that have significant impact on health. And as we understand everyone in the room today, it's not going to be just one factor of influence or determinant. It's not going to be purely environmental, like active travel routes or green area density or air quality, or even softer dimensions such as stress resilience, mental health, or work-life balance, or just biological, like genetic or inherited factors or predispositions to other health elements, or one-off structural incidents like a sports injury. Is going to be a combination. And in other words, as we know, health is complex, and these social, economic, environmental factors interact together to create the conditions where patterns emerge at scale, because individually, as we know, we're very unpredictable, but collectively we can be quite statistical. And it can serve as a mirror of how we organize our cities. Well, in terms of how we approach this, SmartTA understands that we have to act and do, and we understand that we need a holistic approach in practice. So this is where our population health demonstrator comes in. So again, with healthcare delivery challenged by the rise of chronic disease, aging populations, workforce shortage, and unplanned emergencies with the limited resources, you know, we can acknowledge the idea that if I get sick and I'm in hospital being treated, I'm already sick, and it can often take far more resources to address or try to fix issues rather than prevent them. And we can consider this as less of a health policy, more of a sickness policy. And it takes, you know, given that it takes far more energy to correct something than prevent it, what if I didn't get sick in the first place? And this is something that is very well understood within the ergonomic sphere, but not often as well understood across sectors, especially in terms of mainstream practices within them. So, you know, what we aim to do is essentially leverage unique approaches to technology and data-driven insights to engage large numbers of the population to improve our overall health and well-being, and therefore alleviate pressure on the healthcare provision later, where we can essentially take a prospective or preventative approach to population health, and where perhaps we don't need bigger hospitals, we just need less people getting sick. And then we would be better positioning the healthcare provision later. So this is what SmartTA aims to do. by matchmaking novel use cases with technologies that can then serve as exemplars to scale locally, nationally, and internationally. So to give a sense of the district and character area that our initiative is focused on, Dublin 8 is obviously a historic district located southwest of our city centre, with a range of neighbourhoods, including the Liberties, Kilmainham, Rialto, and Inchicore, but also home to notable landmarks and cultural institutions like the National College of Art and Design, or NCAD, the Guinness Storehouse, and the Digital Hub, but also occupying or including the National Healthcare Cluster of St. James's Hospital, the National Children's Hospital, and St. Patrick's Mental Health Services. And again, despite its rich cultural and character area, strong inequities still exist within Dublin 8, whether it be housing stock, air quality, socioeconomic development, urban intensification, regeneration, access to public services or lack thereof, and green area density, all of which have interconnected implications for population health and wellbeing. So although adjacent to Phoenix Park, the district maintains one of the lowest green area densities in the city. So we begin to see significances emerge within this geographical area surrounding the social, economic, and environmental factors mentioned earlier that impact population health. So in October 2020, with this in mind, a consortium of partners was established with a state agency called the Digital Hub Development Agency, if not everyone knows it, providing administrative infrastructure for the programme. And focused on a diverse city centre population of 45,000 catchment area. Smart8 brings together a unique range and diversity of partners within our ecosystem, from local government to national healthcare providers, third-level research institutions, innovators and entrepreneurs in civil society. And this range and diversity of partners is essentially a key differentiator of our initiative, because it provides an opportunity to address the multifaceted subject matter of health cross-sectorally. And that's very important for a whole society approach. So again, we have national pillars of healthcare, such as St. James's Hospital, St. Patrick's Mental Health Services, and Health Innovation of Ireland, as well as wider cross-sectoral partners, such as the Guinness Enterprise Centre, the National College of Art and Design, or NCAD, Dublin City Council, Smart Dublin, and the Digital Hub. And again, this whole society approach offers a special opportunity to address these population health wellbeing challenges by demonstrating new forms of collaboration through this organizational innovation corridor, while polishing new digital technologies on our proverbial doorstep through the demonstrator. So at the start of the initiative in late 2020, Smart8 leveraged the PSIF, or Public Service Innovation Fund, to construct and deliver a survey with 346 local residents in the Dublin 8 district to essentially capture the local needs and priority areas of Dublin 8 and setting the agenda for the programme. So, for example, in the survey, it showed that in line with the Irish population as a whole, 82% of the Dublin 8 residents were in very good or good health, with 40% taking regular exercise. However, 31% had a long-standing health problem, 27% had access to mental health services or supports in the previous 2 years, and 21% had unmet health needs due to waiting lists. And 68% of residents also advised that the pandemic had significantly long-term impacted their health and well-being. But the research also identified services that might help improve the sustainability of Dublin 8 community health and well-being, where 61% of respondents said they'd use an allotment to grow fruit and vegetables as available to them, and 92% would use a recreational park for exercise also if it was available to them. So when the survey is done, these key insights that emerge are just as, if not more important today. And then from the survey, there was a thematic analysis carried out, where essentially 10 key focus areas or health pillars were identified. And it was these key themes or pillars that formed the foundation of the Smart8 programme. So these needs and priority areas identified with the local community could then be drawn upon each year in the form of an open call for pilot projects or solutions, looking for innovations or answers to these challenges or questions. And then 3 open calls were launched in March 2021, 2022, and this year 2023 to seek these innovations, resulting in 12 key pilot projects. So for example, if you look in the upper left, there's Heart of Our City, and this was an initiative between St. James's Hospital, Smart8, Novartis Ireland, and the Irish Heart Foundation to raise awareness of and management of cardiovascular health. And this included the deployment of a mobile health unit to engage citizens on a one-to-one level for free health checks. Now, oftentimes what happens during these pilots is that you bump into insights along the way that maybe you didn't initially anticipate. And after engaging 833 people directly, we learned that over 35% carried a predisposition to hypertension. And then, this is a very unique insight into the local population because, again, anytime there's a skew in data, there's something going on behind it, and it raises questions about how we organize our society. But then in response to these, each of these patients received a GP referral. And a second simple but equally novel thing that Hardware City did was that they did a follow-up with each of these citizens who received a GP referral. So that's something rare in the resource-constrained sector of healthcare provision, where if it doesn't form a specific part of a specific patient's individual plan, it may not happen. So what we found is that 80% of these citizens made lifestyle changes as a result. So it really did show how you can engage populations at scale for a prospective or preventative approach to population health and well-being. And this led to Hardware City being recognized for a highly commended award for the Public Health Initiative of the Year at the Irish Healthcare Awards in 2022. Another pilot from that year is Civic Dollars. So Civic Dollars is the brainchild of an entrepreneur by the name of Stephen McPeak. And it's essentially an app that incentivizes the use of green spaces in Dublin 8 by generating digital currency or civic dollars the more time that you spend there. So we different public parks partnered in the project through Dublin City Council, where each of these parks are then geo-fenced in the app. And the more time you spend in the parks, again, the more digital currency or civic dollars you generate. And these digital currencies or civic dollars could then be exchanged for goods and services with local businesses and supermarkets. And what's very important about civic dollars is that it did not measure steps, it measured time. So if somebody had certain mobility challenges, they could participate just as much as the next citizen. And again, during pilots, you bump into things along the way that you may not have initially anticipated. And with the Civic Dollars app, it ended up creating a direct feedback loop between the citizen or the user and the local authority, where something wasn't working in the park or something's out of place, or it's essentially built a pathway for feedback where it tended to be used more often than mainstream alternatives or traditional feedback pathways. And then of the 1,300 users registered on the platform during the trial period, it really did demonstrate how you can engage large numbers of people, again, to plant a flag where we can all see it, populations at scale for prospective or preventative approaches to health and well-being. So in the case of Civic Dollars, again, it wasn't just a win or even a win-win, it was a win-win-win. Because it incentivized the use of green space for physical and mental health applications. It created a direct feedback loop between the citizen and the local authority, and it generated value that gave back to the local enterprise and local businesses, where it was also interesting at the evaluation stage of the pilot that approximately 50% of the civic dollars generated were then donated to local community groups and charities. And this then extendedly supported pro bono consultancy for local enterprise in the area, again, giving back to businesses. So Civic Dollars then went on to win a PR award in the best use of media relations category at the Awards for Excellence in Public Relations 2022. But more importantly, it's also scaling across multiple cities now following this pilot. So this is something we always look for within our pilots, is that, we may learn things that we didn't know at the beginning. And we may not always have the answers, but we can find new ways of asking new questions. But we always look for the potential for the scalability and transferability of these innovations. Meanwhile, another pilot from last year in 2022 is B8. And B8 is an initiative between the Digital Hub, the National College of Art and Design, St. Patrick's Mental Health Services, and Tyndall National Institute to essentially develop a link between society, nature, and well-being using bees and data. So the beehives are owned and run by the local community. And this is facilitated by one of our community partners, the RECDP, the Robert Emmet Community Development Project. And it includes both economic and health components. Economic, because you can make and sell the honey, and health, because you're out in nature. So it had very strong mental health significances as part of this project plan. But then by bringing in resources and expertise from the Smart Aid partners such as Tyndall National Institute, we could put environmental sensors in the beehives, where essentially turn the beehive or render it as a bioindicator, where it serves as a mirror of the built environment of biodiversity that it's in. So by measuring things like air quality, temperature, CO2 levels, humidity, it then could serve as a litmus of how well the biodiversity in the area was doing, as exemplified by the bee population's health. So in essence, it was a leverage point. So for example, if we want to see the biodiversity in the area is doing, we don't have to go out and investigate every leaf. We just see how the beehive is doing. And when the beehive is doing well, we know the biodiversity in the area is doing well. And when it's not, we know it's not. But this is also very scalable. So it could inform future projects or interventions or policies, such as climate action plans or development schemes, where certain areas may benefit more from intervention more than the next. So we've now scaled up to 22 sensors across 60 beehive locations, providing insights into sustainable community-led beekeeping and honey production at scale. So these sensors then aim to be further developed to capture local air quality and CO2 levels, to again create a feedback loop between local residents and hive managers as the impact on the biodiversity in Dublin 8. Now, following these pilots in 2021 and 2022, this year we launched our third call for pilots in 2023. And these pilots, or this pilot call was essentially based on 3 pillars. So again, these are the 10 pillars that form the foundation of the program, but every year we draw on them to create a framework and specificity surrounding new innovations through the next pilot call. This year, it was population health, positive and healthy aging, and connected patients to community. So for this, we received 60 applications across a range of sectors, also internationally uses and technologies, from which 4 winning pilot projects were selected to transform health and wellness outcomes. And this was across menopause, physical rehabilitation, childhood exercise, and sleep apnea. So this year, our first pilot is Informed Menopause by Dr. Louise Fitzgerald. And Louise is a GP from Grafton Medical Practice in Dublin 2 with strong personal and professional roots in Dublin 8. And as Louise was explained to us as part of our application process for the program, with the average age of onset of at 51, women can spend a third of their life postmenopausal. And while the severity and duration of the symptoms may vary, more than 75% experience menopausal symptoms, with a quarter describing their symptoms as severe. And additionally, it was also understood to complicate pre-existing challenges, whether it be physical disability or stress management. Additionally, the Menopause Hub and IBEC found in their October 2021 report, Menopause in the Workplace, that 1 in 10 women are reported to have quit their careers because of menopause. But again, as Louise was explaining, while some may need medical intervention for the symptoms, for most, it could only require lifestyle advice without resorting to medication. And while structurally there's a challenge where menopause care is often difficult or expensive to access, this creates a structural barrier to the resources that could otherwise empower those with such lived experiences, and again, simultaneously putting disproportionate pressure on the health services that do. So Louise's Informed Menopause Pilot is a community empowerment program focused on improving menopausal health and perimenopausal health in Dublin 8, to improve access to resources to reduce this structural gap towards improved overall health and well-being of the citizens, as well as a reduced burden on local health services. So Louise developed or delivered her very successful in-person launch event, Menopause in the City, alongside an information session of all the digital resources that she compiled on her online Informed Menopause platform, Monday, 16th of October. In line with the week of World Menopause Day, and with great support from Health Innovation of Ireland, St. Patrick's Mental Health Services, and St. James's Hospital within the Smart Aid Consortium. And you can learn more about Louise's Smart Aid Pilot in the Irish Medical Times, the Irish Times, and www.informed.ie, and that's informed.md.ie. Now, our second pilot is Brace by Conor Mottier, and Conor is a chartered accountant turned Dublin-based entrepreneur. with explicit support from the Guinness Enterprise Centre, again within the SMART8 programme. The problem is when it comes to physical rehabilitation after injury, there is an exceptionally high drop-off rate, with completion rates as low as 50%. And this is often as a result of dependence on self-management when away from the physiotherapist, in combination with the mental health factors involved during the recovery journey. And then these low adherence rates then result in a greater burden on the healthcare system, with poor clinical and mental health outcomes. And when you look at the research, as Conor was explaining to us, it explicitly points to social support as an essential ingredient during the rehabilitation process for greater adherence. But currently there's little or no practical means of accessing this. So in response, Brace is essentially doing what Duolingo has done for learning languages. And it's clinician-informed but user-driven, and leveraging gamification through its social injury rehabilitation platform to empower people on the recovery journey, to increase adherence rates, and again, by extension, alleviate pressure on the healthcare provision ladder. Our third pilot is Move Ahead by Dr. Jamie McGann and Dr. Johanni Sartel, two researchers and entrepreneurs based here in Dublin 8, and in partnership with the Digital Hub, with additional support from SICTA, the South Inner City Community Development Association. Now, as Jamie and Johann were explaining, there is a movement crisis as a result of the digital age, where children are far less active during childhood than they used to be, with children under 9 having 6 hours of screen time a day, and this shoots up to 9 hours a day above the age of 11. In addition, after doing a pilot with the GAA, or Gaelic Athletics Association, they learned that the majority cannot run, skip, hop, or jump properly. And this leads to direct negative health outcomes for these children, not just during their childhood, but will have long-standing downstream effects across their lifetimes that we haven't seen yet. So Move Ahead offers the world's first motion analytics and tracking platform built specifically for children. So there's similar technologies that exist in the world, but children are not just small adults. They have their own physiology, they have their own movement patterns, they have their own needs. And what Jamie and Johann are doing is they're combining 15 years of research on children's movement skills and matching that with the technology through state-of-the-art computer vision techniques uniquely applied to children. And this is then being achieved through workshops in schools and after schools programs within Dublin 8, with collaboration pathways facilitated by the Digital Development Agency. And lastly, our fourth pilot this year is obstructive sleep apnea, or OSA identifier, from Dr. Brian Kent and St. James's Hospital. Now, Dr. Brian Kent is a consultant respiratory and sleep physician based in St. James's here in Dublin 8. And obstructive sleep apnea is essentially when people, again, preaching to the choir, but as I say, when people stop breathing their sleep, 1 in 8 men above the age of 35 and 1 in 15 women are reported as being potentially affected by it, which means people are walking around the city every day tired, not knowing why they're tired. And of the minority who actively become aware and pursue diagnosis and treatment, the only way of achieving that is through a very resource-intensive on-site sleep study in a clinical environment. And currently the waiting list is up to 2 years. Again, people who have OSA can increase predisposition to other health ailments such as heart disease, stroke, and diabetes. So the OSA identifier is a digital app platform that essentially leverages wearables that is akin to Fitbit to enable off-site or remote sleep studies, essentially slashing the wait times or waiting lists from 2 years to 3 months. With their industry partner, My Patient Space and ResMed PEI, but also in such a way that the patient never has to set foot in a hospital. So then further alleviating pressure on the healthcare provision. Now, I'm quite happy to say that all of the pilots thus far speak very well to the foundations and future direction of our SMART8 program. And each of these points are essentially, planting a flag for where we aim to go, and scalability pathways through not just partners within the consortium, but also wider collaborators and transferability opportunities. But again, SmartD8 has expanded beyond the pilot scale. So our latest iteration of SmartD8 builds on this momentum to essentially amplify new pathways to innovation through emerging frameworks for smart health and well-being, wider partnerships for healthcare delivery, and quality of life, whether again it be matchmaking between partners, going in larger projects or grant opportunities for larger scale resourcing and timeframes, where essentially everyone can go further together than they would individually. And if you want to learn more, as part of our comms development strategy, we've recently launched a new website, www.smart8.ie. And thank you very much. And I warmly welcome any questions.
Brilliant, Jack. Thanks so much. That was a great overview. And as somebody who suffers from sleep apnea and wouldn't have had to go through that the test, it's amazing that we can do these things at home now, you know, because it was being totally wired up and it was so intimidating and just not nice. But there's great innovations. I've lots of questions, but I might just open it up in case other people have. Or I'll check the chat. Okay, well, I'll go with mine then. So might as well get in there. Jack, so this, my understanding of SmartD8 is, I think it's brilliant because you really are going, as I remember Colin Doherty explaining it, really upstream, and you're trying to stop the, you know, the flow of people into hospitals. So what is the status of it as a program? Like, I know these are pilots that people are coming forward with, and you've mentioned the 3 pilots. Like, because I hate, you know, sometimes it's these amazing things that work upstream that lose funding the quickest when there comes to a, you know, a crunch. Or so is SmartD8 something that will be sustained? And given that it's working so well as a model, are there opportunities to spread it across the country, or what's the?
Very good question. I think there's 2 parts to that. I think the key thing about it is that because it's a consortium structure, that avoids a single point of failure. So SmartD8 is, you know, in essence, resourced by all of the participating partners within the consortium. So everyone puts in a little bit of resourcing, and that creates a collective pool that can be drawn back in the form of partnered projects, where again, you know, where the whole is greater than the sum of its parts. So people can go further together than they would individually. And I think that's very important for the likes of population health and well-being, because health is obviously, again, preaching to the choir here, but I love to say it, and just because I'm biased doesn't mean I'm wrong. Health is very multifaceted, and it takes a cross-sectoral approach. It's not going to be just academia, it's not going to be just enterprise, it's not going to be just public sector, and it's not going to be just civil society. It takes all. In terms of, you know, transferability, you know, the transferability of SmartD8 as a model is very, very high, purely because, you know, it's the way it's structured is that it works cross-sectory, and you know what it says it will do, it does, and you know there's added transferability because of the universality of health. So even though Dublin 8 is very, very specific cultural and character area, and a very, very unique context to explore these health clusters and these innovations and these cross-sectoral partners and collaboration opportunities, it's not limited to it. So there are many places in the world, and it doesn't even have to be an urban area. You know, everyone faces health challenges, and a lot of the time, we may not actually know them. You know, by working together, you can actually offer new insights into things that could affect other things later. I was at a talk in Woodkey by some members of Dublin City Council a few weeks ago, and there's a slide on climate action policy, and they said, you know, if you're not addressing the climate crisis, you're not addressing health crisis, and it just really speaks to the entanglement that we're in. You know, there's a huge amount of interdependent parts, you know, whether it's root causes, downstream effects, or otherwise, that play a role in you know, how we live day to day. And you know, it's health is a very, very key part of that. People use different words to describe the same thing. Like what you could call active travel or climate action or green area density. All of those have huge health implications, and there's something very, very interesting about, you know, the non-mutual exclusivity of it. where, you know, by looking outside of clinical environments, you could then better position the healthcare provision later within it.
Brilliant, brilliant. Any questions? Just jump in, guys. Yeah, Cora.
Thank you, Marie. Thanks a million, Jack. I found that a really, really informative, very interesting presentation. It's a lovely example of macro and global ergonomics that sees the whole system and the interconnectedness of things, keeping people healthy, keeps them out of hospital. So that's really good. My question is a little bit linked to Marie's, and it's, I don't fully understand how the organization works. I can see that there's a collaboration between an awful lot of different agencies. So there's obviously something that triggers that collaboration and pulls it all together, and I'm not sure that I fully understand it. I think you mentioned at the beginning, it's this organization that looks at regions, nations, and globally. So is there an international organization that, can you just help me to understand that? And maybe just speak a little bit about, you talked about links with St. Pat's Hospital and with St. James's Hospital, but anything else within, say, the HSE, they're not HSE organized. Well, St. James's is a Section 38, St. Pat's is not. Anything with the HSE, you know, the Irish Public Health Services. Sorry, that's a lot of questions, but thank you. Your presentation was fantastic. Thank you.
No problem. Thank you for the question. It sounds like there's also two parts to that. So I suppose in order, there's no international dimension internally within SMART-T8. It's a little bit more bottom up than that. It's not that we initially fell under, you know, an international or cross European or global umbrella like the World Economic Forum, the World Health Organization. It was really you know, partners within Dublin 8 coming together to create this. Now, SMART-T8 itself is a brand, and you know, it's again the Digital Hub Development Agency provide the administrative structure or infrastructure for the program. So every partner is, of course, their own registered entity that have their own internal processes and mechanisms as per their own sectors. But to work cross-sectorally, essentially SMART-T8 is an umbrella. But for anything that SMART-T8 does, if we're delivering an event, if we're seed funding pilot innovations, it's essentially done through the administrative partner on behalf of the program. The way it works is that every partner has you know, a collaboration agreement or a deed of adherence, and that essentially offers you know, an overarching umbrella internally. But again, in terms of an external face, it's facilitated by the Digital Hub. So we recently delivered an in-person event at the Guinness Enterprise Centre. So it was opened by Lord Mayor of Dublin, Councillor Dai Durashta, and then we had two panels of speakers, previous pilots and current or live or ongoing pilots. And again, it's, you know, those in-person presences, it would be facilitated by the collective resourcing internally by each of the partners. We have 4 lead partners and then 8 associate partners. So it's led by the Digital Development Agency, Smart Dublin, Dublin City Council, and St. James's Hospital. And then everyone else is an associate partner as part of that structure. So it means that you have opportunities to you know, work together with this in-person or digital, collaborate, open up and unlock internal and external networks, ecosystems, skill sets, and resources and expertise. But in terms of structurally how it works, it would be done through the interface of the Digital Hub as one of the lead partners and the administrative partner of the program. Now there's a second question you had.
The HSE. So
yes, yeah.
So St. Pat's is a private hospital, I suppose, and as Cora said, St. James's is a Section 38. It's not a it's a voluntary. So is there any public health involvement? Any public, sorry, the HSE involvement?
So HSE Digital Transformation is one of our partners, but again, you know, SMART-T8 is very young, so we're now in our 3rd year of operation, but the structure has been the same since the outset, and that was the same timeline that coincided with the PSIF, or the Public Service Innovation Fund, to capture the needs and priorities of the district and form the foundation of the program. In terms of those mechanisms of how each individual entity works, it doesn't cross over or restrict those. So there's essentially Smart D8 is as a corridor, an organizational corridor between entities. We're not tied to how their internal mechanisms or reporting works. Really, it would be contingent on whatever is interface procurement or administration be going through. So again, we don't try to change how other partners work, but it really gives a collective space to let other partners know what's actually happening. Yeah. So the way it works is we have 1 to 2 contact persons in each partner organization, and we meet every 6 to 8 weeks to review current status, let other partners know of any upcoming opportunities, and essentially it takes stock and reflect on where we've come, where we're at, and where we're going. So that has been very, very important as well structurally in terms of building a culture and a momentum around the program. Because a lot of times what happens, not just cross-sectorally, you could be in the same sector, is there are things happening and people don't know next door what's happening. Because especially in healthcare, it's so resource constrained, and every day could be firefighting. And that is essentially what Smart D8 does. It gives bandwidth for exploring things outside of your 9 to 5 that you wouldn't have in your 9 to 5 or even within your own clinical walls. So again, in terms of administrative, structures or mechanisms, all partners preserve their own way of working. It really just opens up the conversation for conversations that wouldn't have been had otherwise. And in terms of Smart D8 specific deployment, that would be facilitated through the infrastructure of the administrative partner, the digital hub.
Brilliant. Thanks, Jack. Yeah. And maybe last, I'm just conscious of time. We try and finish around 1:45 just to let people have lunch. But just Enda, you have a question.
Yeah. Apologies for not turning on my camera, but I'm in an Airbnb and it's a bit of a mess.
I respect it.
The temperatures are quite high outside. I better not say that. Just one was a comment, I suppose. I'm interested in the project the GAA are involved in. You seem to say there was some sort of a device that they're using for movement and flexibility. Maybe I'm mistaken. What kind of prompted not my interest, but prompted me just to say something is that I'm involved in a SEN standards project where we're collecting data of children. And the drivers or the motivators, if you like, for that project are coming from toy manufacturers, children's products, and particularly play areas and that kind of associated equipment. So I suppose I'm just wondering a little bit about that device that I saw in a picture, and maybe I'm mistaken. And then my second commentary is, my second thing is a question. Is this a pilot, and where do we go next?
Yes. There's a pattern where every question is at least 2 parts. I'm happy to take both of them. So yeah, if I'm right in my understanding, there was a stock image of a device, but I believe that was the 4th pilot, the OSI identifier. But if you're talking about the motion analytics platform by Move Ahead, by Jamie McGann, Lehane, Sarshell, that was the motion analytics platform to track childhood movement. And you're quite right, they're the ones who had done previous work with the GAA. So they would use this platform to essentially track children moving in a space. And they have a website that I'll put into the chat, and this will make things more available to everyone.
I'll do that, Jack. I found it, yeah.
Oh, perfect. Yeah, so it'd be moveahead.io.
Thanks, Jack.
But so Jamie and Johan would be more than happy to speak about their specific involvement with the GAA. Within Smart D8, we look for internal project delivery capacity as well as experience, and that was simply the experience that they're bringing to the table as part of their deployment of the project with us. As for this specific work they did, the GAA, I couldn't speak as much about that as Jamie and Johan, but it does do that. It would map certain parts of the body, like elbow, shoulder, waist, neck, knee, and then what it would do is actually it would track that in such a way that all the data is in its raw form is already anonymized. So it's fully compliant with all GDPR, but then you can actually show how certain movements can improve over time, because they will have baselines as well from previous work. And then if you could remind me of the second part.
Second one was really, is it a pilot? Is this a pilot? And
yes, what happens next?
Yeah.
So again, not all pilots scale immediately. Now we have pilots that have scaled nationally and internationally. One pilot that wasn't presented today, but it was actually done with the support of Walk in My Shoes initiative within St. Patrick's Mental Health Services, and our contact Amanda McCardle as part of that pilot was, Ways to Wellbeing was an intergenerational project to engage children to capture stories through different media with older members of the local population. And then that ended up being compiled in the form of an online portal that scaled nationally across all schools, or multiple schools, as well as an in-person exhibition on St. Patrick's Mental Health Services site. Then another one that scaled internationally was Civic Dollars, and have since had partnerships in the UK for this exactly the same scalable engagement. What
Just
happens to pilots?
Jack,
Sorry,
yes. Enda, did you mean was Smart D8 a pilot, or were the projects?
Well, I did, yeah, but I mean,
it was the whole thing.
No, Smart Data is a program. All the projects presented today are pilots, and we're also looking at project collaborations beyond pilot scale. So these pilots are the selected projects from the open call we have each March that draw on the pillars that we identified.
Are we going to get a Galway G8 or something like that? No.
Well, it's a competitive call every year, but all people are eligible to apply, and we're also more than happy to speak more about ways that these models can be mirrored or transferred. That's something that we're always looking for, because in the same spirit of the partnership and the program foundation, people go further together than they would individually, and that's something very interesting for us.
I suppose, can I just make one last comment? I was really surprised by the numbers you gave. 31% of long-standing health problems, 27% access mental health, and 21 had unmet health needs. I'm presuming that's not typical of all the areas of our urban area.
Dublin 8 is
urban areas.
Yeah, Dublin 8 is a unique area, isn't it? Yeah, definitely.
So, exactly. So it's anytime you have a place, like I was saying, individually we're very unpredictable, but collectively we're very statistical, where patterns emerge. And just like the beehives with the biodiversity in the area, the skews and data can serve as a mirror of how our places are being organized, whether it's urban or rural or in Ireland or beyond. But it's always a combination of social, economic, and environmental factors. For example, there was a case where if the data of different clinical environments were mapped, and one had a skew where staff were arriving later than the others. But then by simply addressing a bus route, they all started arriving on time. So by moving out of the healthcare sector, you're able to fix the healthcare provision.
Yeah.
And mapping this data is very, very good, because we don't know what we're talking about otherwise. And this speaks to my point earlier, which is that many of the insights we don't know yet. But just by working together, we can actually, shine a light on what is otherwise invisible. And that becomes a starting point where, again, the whole is greater than the sum of its parts.
Thanks, Jack.
Thanks. And there's loads of interesting. And Joan, I see your about the menopause, like that. The stats on the menopause are shocking. How many people leave their job? That's extraordinary.
I learned a lot from these. All the pilots actually.
Yes. But Jack, I'm so sorry, we're out of time.
That's no problem.
But just really want to thank you so much. I mean, it is fascinating, and it's such a model we could all be, working towards. So we might get you back again, next year, the year after, and see how it's going then. So just want to thank everybody for attending today, and just say our next one is in person, Chiara, isn't it? With you and Diego in TU Dublin.
So we like to repeat the experiment of last year. So we'll invite you all for the 14th of December to have mince pies and a bit of tea and coffee with us to celebrate the Christmas
Christmas,
holidays, and also
yes.
to discuss we have different speakers. One of them is Joel herself, who was with us a few minutes ago. And we also invited the Chief Inspector for the Rail Authority in Ireland to discuss how human factors impact different areas for, from the perspective of the public authority inspecting workplaces in different work environment, and how human organizational factors can make a contribution towards their current practices. So that's the idea. So we'll circulate a notice for that.
Yes.
So
and if we could attend in person, it'd be great if at all possible. But if not, it is online as well.
Yes,
it'd be great to meet people in person.
We should invite you to join our mailing list, because I will try to circulate on the mailing list. So you've received the invite. We actually organize, myself, Diego, and others in the committee of the Human Factors organize these webinars.
It would be an honor and a pleasure.
Great.
Yeah, and
great.
it'd be good to have you there. Okay.
Yes. Transdisciplinary is the way to go. So it's great to have architects and different people involved.
Yeah, you have a fantastic profile also, because human factors is exactly at the juncture of these different disciplines, and how they combine well together for the purpose, for the right purpose.
Yes.
I'd like to think so. Yeah.
Exactly. We learn a lot from you today. Thank you. So we'll
Absolutely.
the new on social media and on the newsletter and on the mailing list in the next couple of days.
Super. Thanks, everybody. Thanks a lot, Jack.
Thank you very much for having me.
Thanks.
Thank you. Bye, everybody. Bye.
Bye.